will explain that thing. So actually the parietal pleura has got a different part. It has got a costal surface is there, mediastinal surface is there, diaphragmatic surface is there, apex is there. Okay. So the part of parietal pleura face along the side of mediastinum, that is the mediastinal surface of parietal pleura. For the same this part of pleura, you have called the mediastinal pleura, isn't it? So this is actually mediastinal surface of parietal pleura. So the two lateral boundaries formed by the mediastinal surface of parietal pleura. Okay, this one surface, next surface. Okay, are you getting? Okay, so the two surface, on the lateral surface you will see the mediastinal pleura, that is the mediastinal surface of parietal pleura. Okay, so mediastinal part of, so there, that is mediastinal pleura. Actually that is mediastinal part of parietal pleura only. Okay, so that forms the two lateral boundary. Where? And in this part only, in this surface only, in this two lateral surface only, root of lungs are attached. Okay, root of lungs, okay na, this part, see, this truss. So this root of lungs. Are you getting?
Yes, sir.
From this part only, from this part, from the medial part, two lateral part. So the root of lungs is attached. Okay, in this lateral surface only. So the two roots of lungs are attached on the either side, one in one side, one in next side. Okay. Now we'll go for the division. Division for the mediastinum. Now this whole space is the mediastinum. Now again it has got a minor division. Now see here. This is the diaphragm is here. Thoracic inlet is here. Posterior border is here. Anterior border is here. Now see here, you will see something here. Heart you will see in this greenish color, isn't it? And just here you will see the one yellow color plane, and just above the yellow color plane you will see this like pinkish structure, isn't it? Okay. Now see. Now here they are the division. Okay, how they have divided the mediastinum. Now see. So the division, it has got a two division. Okay. Superior and
Inferior.
first two division are there first. Okay. So see, can you see this yellow color plane here? So this is the transverse thoracic plane. So that is the don't get confused with plane of thoracic inlet. Okay, that plane of thoracic inlet is different. That lies here almost. Okay, this is transverse thoracic plane. This is different. Okay. So see, this transverse thoracic plane. This is imaginary plane only. This plane you will not see in body. Okay. So this is the imaginary plane. The shortcut I will write imaginary plane or imaginary horizontal plane. Imaginary horizontal plane that passes from sternal angle up to the lower border of T4 thoracic vertebra. Okay. Now I will tell you. See this yellow color plane here. This is the transverse thoracic plane. This transverse thoracic plane only divides the mediastinum into two parts, that is superior and inferior. So how this transverse thoracic plane passes? See here. Anteriorly, it passes from the junction between the or joint between the manubrium and the sternal body. So this is the manubro-sternal joint or sternal angle. So this transverse imaginary plane or horizontal plane that passes at the level of sternal angle anteriorly, and as it passes back posteriorly, it passes along the lower border of the fourth thoracic vertebra. Okay, lower border of the fourth thoracic. T4 means fourth thoracic. Lower border of the fourth thoracic vertebra. So this imaginary plane now divides our mediastinum into superior and inferior. Just above this plane, this pinkish color you are seeing here, that is the superior mediastinum. Just below this plane, you are seeing here this greenish color. This is the inferior mediastinum. Are you getting here? Are you getting?
Sir. Yes, sir.
Speak, okay. See here. Now, previous picture, see here. See, can you see here? One line you can see here. See this line. This line represents the transverse thoracic plane. So this junction here, this is the sternal angle. So it, from sternal angle to the lower border of the T4, just you draw one line here. Just above this line, this part is the superior mediastinum. Just below is this whole thing. This is the inferior mediastinum. Okay. Now see here. Now again. Now superior and inferior, okay. Now again we'll go for the inferior, okay. Now see, again the inferior mediastinum, this whole thing is the inferior mediastinum. Now this whole inferior mediastinum is again divided into three, okay. They are anterior, posterior and middle, or anterior, middle and posterior, okay. Now how they are divided I will tell now. Now superior is only one, single is there, so there is no other division for the subdivision for the superior. But the inferior mediastinum, it has got a three subdivision: anterior, posterior and the middle, okay. Inferior mediastinum, so that is, so the inferior mediastinum, it has got a three subdivision. How they are divided now I will tell here. Now I'll go for the previous picture here. Okay, now see here. Now you can see the transverse thoracic plane, you can see the diaphragm, isn't it? So this region between the transverse thoracic plane and the diaphragm, this region, this is the inferior mediastinum. Now inferior is again divided into anterior and posterior and middle. Now see, the division is with respect to the position of pericardium and heart. Okay, if you see this, can you see this oval like structure? Actually it is not oval. Can you see this structure?
Sir.
Yes. So this structure, that is the region, or that is the position for the pericardium and heart. Okay. So just anterior to this position of pericardium and heart, can you see this minimal space in between sternum and this pericardium here?
Yes, sir. Yes, sir.
Yes, one space is here. Can you see the minimal potential space behind this pericardium here, this region, and in front of vertebra, this region? Yes. Now one is this only. Okay. Now see, just behind this one region, just anterior to this region, one region, and one is this same region only. So they are anterior mediastinum, middle mediastinum, and the posterior mediastinum. Are you getting?
Yes, sir.
Okay. Now, so the inferior mediastinum, it is divided by the, with respect to the position of pericardium and heart. So the pericardium and heart lies in the middle mediastinum. So the anterior to the heart, pericardium and the heart, and just behind the sternum, that is the anterior mediastinum. Just behind the pericardium and heart, but in front of the vertebra, this is the posterior mediastinum. So anterior mediastinum, and the heart is in the medial mediastinum, and this is the posterior mediastinum. Okay. Okay for division. Any doubt, anyone? Now only ask. All are there. Video is on. Make the video on once. Boys are there, or they have just joined and okay. Are you getting, boys?
Yes, sir.
Okay, if any doubt, just ask only. Okay, here up to here, just you ask. Now we are going to read the individual mediastinum now. Now we are dealing the superior and the inferior, that is anterior, middle, and posterior, and the content in the each mediastinum we are going to deal. Up to here, okay, na? And no doubt is there, na? Boys, for girls, no doubt. Boys, at least you say, na? No doubt or yes? Okay, means if you are not speaking means no doubt. Okay. Now we'll go further. Now see, before that I will deal about the sternal angle. Okay. While reading the transverse thoracic plane, we have heard one terminology, that is the sternal angle, isn't it? Now this angle, this is the sternal angle. Now for this, I'll go for the next slide. Okay. Now see here, see in this slide here, see in this middle one picture first. See, this is the sword-like bone. Okay, tarvar. Okay, like bone. This is the sternum. This is the flat bone that forms the anterior midline boundary of the thoracic cavity. Now see here, it has got one part here, next part is here, and next part is small part is here. So this is the manubrium. This part is the body of sternum. This one is the xiphoid process. If we see the laterally, it is like this. This is the manubrium. See here, manubrium. From here to here, this is the body of sternum, and the inferior pointed portion, that is the xiphoid process. Okay. See here, this is the manubrium. This is the body of sternum. You will see here joint. You will see here, isn't it? See here. So this is the manubriosternal joint. Okay. Or the next name for this joint is the sternal angle. Okay. Or next name for this joint, that is the angle of Lewis. Actually, see, angle of Lewis. See, actually the next name of joint, the name of joint is the manubriosternal joint. Okay. And that joint that forms the certain angle, means suppose, see, are you seeing my hand? See, suppose this hand is the body of sternum, this hand is the manubrium. Okay. So see, they are making joint here. Okay. They are not like this. It is not like straight. They form slightly bent like this. Manubrium. This upper hand is the manubrium, suppose. Okay. Now this hand is the body of sternum. Okay. It is not like straight 180 degree. It is not like this. Okay. It's like this. Slightly bending is there. It is not 180 like this. So it has got not 180 degree angle, slightly bent like this. So can you see this joint portion here? So this joining part, it is slightly elevated, isn't it? Can you see in my hand here? Slightly it is bulging out, isn't it? So this bulging at this manubriosternal joint is known as angle of Lewis or sternal angle. This angle is the sternal angle. This angle is approximately 163 degree. Somewhere 163 degree. Okay. It's not 180 degree. Okay. So in some book 163, 167 degree. So it may vary. Okay. 1 to 2 degree. Okay. No problem. So this is the sternal angle. Are you getting now? Now see, this angle you can feel in your body also. Just here, put your finger here. There is the one notch is there. So this is the jugular notch. Just one hand breadth below you put from here. Okay, or 5 centimeter below from this joint, you will feel one transverse ridge. Just you feel that one transverse ridge you will feel. That is transverse elevated portion you will feel here. Okay, in that junction, in between the manubrium and the sternum, you will feel one elevated bony ridges. That is the angle of Lewis. Because I am telling this angle, Lewis will focus because this may be your Viva question. What is the importance of this angle of Lewis? Sometimes it may be the very short question for the theory exam also. Okay. Heading, note in angle of Lewis means you have to write all these things. So this is the angle of Lewis. Now see this angle of Lewis, it has got some important here in anatomy. Okay, it gives some certain landmark. Okay, it is the landmark. Okay, it gives the surface landmark from certain structures. Okay, so what is the importance of angle of Lewis? Now I will deal here. See. So here, what may be the first importance? While we are going to divide the mediastinum, we have taken the this region only, isn't it? Superior and inferior is divided on respect to this only, isn't it? Above this, the level of angle of Lewis, that is the superior mediastinum. Just below that level, that is the inferior mediastinum. Because our transverse thoracic plane that passes from the angle of Lewis anteriorly and this is at the lower border of the fourth thoracic vertebra, isn't it? So one surface important is it is the landmark for division of the mediastinum. First point. Okay. So it is the landmark for the division of the mediastinum. Just above that is the superior, just below is the inferior mediastinum. So the transverse thoracic plane passes from this angle of Lewis. That is first. Next. Now see this lateral surface here in the picture. Here. Can you see here? See, can you see this bluish color here, depression here?
Sir.
Can you see in this picture, third picture, you will see the bluish color depression here. Something you can see here, isn't it? See this blue color. Actually, this is the site for articulation of ribs. Ribs are going to attach in this region. They are the facets for ribs. Facet, postal facets. Facet, that is the articulating surface. Okay. So in that facet only ribs are going to articulate. Now see, again the angle of Lewis, it has got a next importance. While counting the ribs, you are going to count from this point only. See, in living body we cannot see ribs, isn't it? Can you see the ribs? We cannot see. But we can feel the angle of Lewis, isn't it? So see, at the level of angle of Lewis, there is the articulation of second ribs. Second ribs is articulated here. See here, third picture. Can you see here this point? See, this is the site for articulation of second ribs. First rib is somewhere here, but we cannot feel that here due to the clavicle. So while counting the ribs in the living body or in cadaver, you are going to feel the angle of Lewis and you are going to count from second, then we can feel third, fourth, like that. So it has got a next important, that is for the counting of ribs. So we are going to count the ribs. So second ribs articulate at this sternal angle. Okay. So from second ribs we are going to count. Second, third, fourth, fifth, like that. Because first we cannot feel in the living body also because we have a clavicle here. So the clavicle covers that ribs. So we cannot feel the first rib. So now just you feel in your body only sternal angle and goes laterally, you will find the second rib, like that. Okay, this is the second importance. So this is the site for counting the ribs. That is the second ribs we articulate in this region of the sternum, angle of this. Now see here, first picture, can you see here? Sternal angle and one line you can see here. Can you see one greater vessel here? Greater vessels, can you see here? See, this is the arch of aorta actually. Arch of aorta. From the heart, there is the beginning of ascending aorta, then continue as the arc of aorta, then descending aorta. So, sternal angle again, at the level of sternal angle, there is the beginning of arch of aorta and termination of arch of aorta. Next clinical important is, so beginning of arch of aorta and termination of arch of aorta. Third point. Beginning and the termination of arch of aorta. In other word, you can write termination of or site for termination of ascending aorta and the site for beginning of descending aorta. See, if arch of aorta terminate means there is the beginning of descending aorta, isn't it? So it is the site for beginning of descending aorta also. If arch of aorta beginning means this is the termination of ascending aorta, ascending part of aorta. While reading the aorta, it has got a certain part, ascending part, arch and descending. So here the beginning of arch of aorta and the termination of the arch of aorta. Okay. Okay, now other picture I am not able to get. Now I will explain in word only. Now see, actually this angle, now third point, okay, beginning and termination of arch of aorta. I have written here also, just you want to see, I'll go for the next slide. Actually I want to show you in picture, so only I have shown in that picture. I have got a slide on also here. You can copy from this also, no problem. Now see, because from picture it will be more clear. Now see, third point, okay. So beginning and termination of the arch of aorta, or for that point you can write termination of ascending aorta and beginning of descending aorta also you can write. Okay, that is also you can write. Now next point, see, you know this here, trachea. First listen and write, no? Don't only copy only. Okay, you should know. Okay, see, you know the trachea here is trachea, isn't it? So trachea it will divide into two, isn't it? Right and left bronchus. So at this level only. So the trachea bifurcate into the right and left principal bronchus in that level only. So the which point? Fourth point it is. Okay. Now in the fourth point, right, bifurcation of trachea into right and left principal bronchi. Now next point. This fifth point I will make it short for you. Okay. Now see, here it is written it arcs over the root of right lungs. Root of lungs you have got, na? Initially. That is root of lungs. See, azygous vein. It is going to arc above the root of right lungs, and it is going to open in superior vena cava. It is written like this. But right in short, at this level, azygous vein open into superior vena cava. Just you write azygous vein open into superior vena cava at this level only. Or you can, if you can remember this whole thing, you can write it arcs over the root of right lungs and open into the superior vena cava. That is okay. Okay, for shortcut you can write azygous vein that opens into the superior vena cava. Or azygous vein, you know about the azygous vein, where it is? Where it is? Don't know. So actually this vein, it drains the blood from the wall of the trunk. Okay. Body wall, from the body wall it will drain the blood. Okay, it will carry the blood from wall to the superior vena cava. Now next one is that again at this level only pulmonary trunk divide into two, right and left pulmonary artery. You know pulmonary artery? If it is picture, I'll go for next slide, okay, to show the picture. Okay, now see here. Can you see here? This is the superior vena cava. Here pulmonary artery is not there. Okay. Okay, I'll go for this. Can you see here? This color picture here. Purple color picture, can you see here? This whole trunk. This is the pulmonary trunk. Okay, so the pulmonary trunk it divides into left and right at this level only. Now see, this is arch of aorta. Can you see this? Arch of aorta. Beginning of arch of aorta, termination of arch of aorta in this point only. So in this point, now this may be the fifth point, isn't it? Or sixth. So the pulmonary trunk divide into right and left pulmonary artery. That is sixth point. Okay, right. Right. So the pulmonary trunk divide into right and left pulmonary artery in the level of sternal angle only. So this is the next important of the sternal angle. Okay. This is the pulmonary trunk. See, pulmonary trunk from where it begins? See, it begins from the right ventricle of the heart, isn't it? Then it divides into right and left, and from right and left pulmonary artery, the blood will go to the right and left lungs for the oxygenation. While reading the heart, I will tell. Okay. Now next point is the pulmonary trunk. Now next one is the thoracic duct crosses the right to the left side. See, thoracic duct, that is the duct, lymphatic duct actually. This lymphatic duct that carries the lymph from the most of the part of the body. Okay. So that thoracic duct it lies on the right side, along the vertebra actually. Okay, so at this level only it goes from right to left side. So means from initially it is on the right side. From at when it reaches at the external angle, from right it will go to the left side. Okay, so this hand is my right hand, so it runs along this side. Then at this external angle only it will go to the left side. From here it will go to the left. So it crosses the midline and goes to the left side. Okay. If picture is there, I will show you here. So see this picture here. Yes. Can you see this beaded color picture here? Green color, beaded color, beaded structure. This is the thoracic duct. See, initially in this side. Now from here it is coming this side. See the esophagus with respect to esophagus. It is here. Now from here it is coming this side from back side. See, coming here. So this is the thoracic duct. So the thoracic duct it is crossing from right to left from at this level only. Are you getting up to here?
Yes, sir.
No problem, na? Now next is it forms the base of the heart or the upper limit of the base of the heart. Base. It is the upper limit of the base of the heart. Okay. Or that means that is the base of the pericardium actually. See this. This is the limit of the base. Can you see this picture here? This green color, this is the outline of parietal pericardium. Okay. So the parietal pericardium, it has got a apex, diaphragmatic surface, base. So this base, it lies at the level of sternal angle only. This green color. Okay. Okay. Are you getting? At least you remember up to 7 points. Okay. At least 7 points, they are very important only. Remaining, if these 2 points you forget, also no problem. So that forms the upper limit of the base of the heart. Okay. Okay.
Sir.
Why base? See why base of the heart? Why that is called base of the heart? Because see all the vessels coming to the heart and leaving from the heart is attached in that side only. In that side of the heart, you know. That is the base of the heart. Okay. In heart, I will deal this thing. Okay. Just you remember here only. So that lies at the upper limit of the heart. Okay. Now next is the cardiac plexus is situated here. Cardiac plexus. Plexus means network. Okay. See, before any nerve entering to the heart, they will first form the plexus. Okay. They will make the network outside only. Then from there they will go to the heart. Like that. 8 and 9 number not so much important for you. Okay. Just you be familiar. That is sufficient. But up to 7 point, you should not forget. They are the very important. So that it is the sternal angle is the most important landmark. Okay. Because it is going to guide the various things. Okay. Okay. Now in cadaver, if I told you just count the ribs means how to count. You got first you have to feel the sternal angle in cadaver. Then you have to go in the side of that cadaver, that sternal angle. Then you will find there is one ribs is attached. That is second. And just go on feeling down. There next will be third, fourth, fifth, sixth, like that. Because from first rib we cannot count, because first rib is under the cover of clavicle. So we cannot feel here. Because see here we can feel clavicle only. Just behind the clavicle is the first rib. So we cannot. So this angle of ribs that gives guidance for counting the ribs also. Are you getting? Or feeling sleepy? Kavita is yawning, so maybe feeling sleepy. Boring lecture.
Sir.
Okay. Now this is about the angle of Lewis. Okay. Because see the transverse thoracic plane was coming and this terminology angle of sternum was coming here. So I explain this thing. Okay. Now we'll go for the superior mediastinum. Next class is there, then you can leave or what to do.
Yes, sir.
And then you should tell, na? Sir, we have got a next class also. Okay. Any confusion up to here? No confusion, na? At least move your head. If no audio, then move your head. Okay. Okay. Shall I go for next class?
Sir. Yes, sir.
Okay. Thank you, class. Now I have next class for your first batch, I think. First pro. Okay. Bye.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, class. Subdivision of the mediastinum. First, initially, it is mediastinum is divided into two: superior mediastinum and inferior mediastinum. Then again, superior mediastinum, it does not have got any division, but inferior it has got a three division. They are anterior, middle, and posterior. Now we are going to deal the individual mediastinum. Okay. Now first is the superior mediastinum. Now see, again first we have to know the boundary of superior mediastinum first. So boundary of superior mediastinum, anterior boundary we have to see, posterior boundary we have to see, superior boundary we have to see, superior boundary we have to see, and the inferior boundary we have to see. After seeing the boundary, we have to see the content of the superior mediastinum. Okay. Now for each mediastinum, we are going to see this thing. Boundary we are going to see, and the content we are going to see. Okay. Now first we will go for the boundary of superior mediastinum. Okay. So what may be the anterior boundary of superior mediastinum? Posterior, posterior surface of
Sternum.
manubrium. So the posterior surface of the manubrium that forms the anterior boundary of the superior mediastinum. See, don't tell only sternum because sternum forms the anterior boundary of whole mediastinum. Here we are only dealing for the superior mediastinum. Okay. So the anterior boundary for superior mediastinum that is formed by the posterior surface of the manubrium. Okay, I saw you this thing in picture. So we have to go in previous slide. Now see here. See here. Can you see this picture? See here in this picture. See, this is the external angle, and one horizontal plane is there. This is the transverse thoracic plane. Just above is the superior mediastinum. Okay. Now see, we are going to see this region, superior mediastinum. This region we are going to see. So this is the anterior boundary for the superior mediastinum. This will be the posterior boundary for the superior mediastinum. This itself, it will be the boundary for the inferior superior mediastinum, that is inferior boundary, and this will be the superior boundary for the superior mediastinum. Now see the anterior boundary. See this whole bone, this flat bone, this is the sternum only. So see, sternum it has got a part. Manubrium is here, body of sternum is here, and xiphoid process. So see, only the manubrium is related to the superior mediastinum in the anterior aspect. So the anterior boundary is formed by the manubrium. Manubrium, see, it has got an anterior surface, posterior surface. So the posterior surface of the manubrium that forms the anterior boundary of superior mediastinum. Are you getting? Are you listening?
Yes, sir.
Yes,
Okay.
sir.
So the anterior boundary is formed by the posterior surface of manubrium of the sternum. This is the part of sternum only. If you say sternum is this whole thing will be sternum. Okay. So this whole sternum is not related for the superior mediastinum. Only the manubrium is related in the anterior aspect of the superior mediastinum. So the anterior boundary is by the posterior surface of the manubrium, or directly you can write manubrium only also. So this is about the anterior boundary. Now let's see for the posterior boundary. See posterior boundary. Can you see this vertebra? 1, 2, 3, 4. Four vertebra. So the posterior boundary that is going to form by the vertebra only. Okay, I'll draw one here. Okay. So the posterior boundary, see, thoracic vertebra. 1, 2, 3, 4 thoracic vertebra, and in between this each vertebra you will see here the piece of cartilage that is the intervertebral disc. So the posterior boundary that is formed by the posterior boundary by the body of T1 to T4, means that is first second, third, and fourth thoracic vertebra. T1 to T4 thoracic vertebra and adjoining intervertebral disc. So this 1, 2, 3, 4. So this forms the posterior boundary of superior mediastinum, including the intervertebral disc. Okay. So this is the posterior boundary. Now we'll go for the superior. Superior boundary. So this is the superior boundary. So the superior boundary that is formed by the thoracic inlet or plane of the plane of thoracic inlet that forms the superior boundary here. So see the plane, it passes anteriorly in the upper border of the manubrium, or that is at the level of supraesternal notch or jugular notch, and posteriorly it passes at the upper border of first thoracic vertebra. Okay, at this level this is the plane of thoracic inlet. So it passes anteriorly at notch and posteriorly to upper border of first thoracic vertebra. So the plane of thoracic inlet, that is imaginary plane only. Okay, so this is the imaginary plane. Okay, that passes anteriorly at the level of superior external notch or supraesternal notch, and posteriorly to the upper border of first thoracic vertebra. So this is the plane of thoracic inlet. So this is that forms the superior boundary. Through the superior boundary, the superior mediastinum will communicate with the neck region also. Okay, so next is the inferior boundary. So if you see the inferior boundary, this is the inferior boundary here. Okay, so there is no inferior boundary, so there is the imaginary plane is there. So inferior boundary, there is the transverse thoracic plane. So this transverse thoracic plane, this is again imaginary horizontal plane. Okay, you know this thing. So it passes anteriorly at the level of external angle and posteriorly at the level of lower border of T4. Okay, border of fourth thoracic vertebra. So this is the imaginary plane on the inferior boundary of superior mediastinum. In the superior boundary of superior mediastinum, there is again one imaginary plane, that is the plane of thoracic inlet. Okay, are you getting? Are you listening?
Yes, sir.
Okay, at least you speak. Okay, better you make your video on. Okay, so these are the boundaries. So anterior boundary, posterior boundary, boundary, and the inferior boundary. So the anterior boundary is by the inner surface or posterior surface of the manubrium. Posterior surface of the manubrium. Posterior boundary, it is formed by the first four thoracic vertebra, that is T1, T2, T3, and T4 thoracic vertebra, along with the adjoining intervertebral disc. And the superior boundary is by the plane of thoracic inlet. Okay, that passes along the supraesternal notch to the upper border of the first thoracic vertebra. And the inferior boundary, that is by the transverse thoracic plane, that passes anteriorly along the external margin and the posteriorly at the lower border of the fourth thoracic vertebra. So that forms the four boundary of the superior mediastinum. Okay, now we'll see the contents. What may be the content? Now see, we'll see the content now. Okay, what are the structure you will find in the superior mediastinum? So the content, we can classify the content. See, we'll see some muscles, we'll see some tubular structure, we'll see some vessels, we will see some nerves, and we'll see some gland also. Okay, in the superior mediastinum. Okay, or directly you can list the content also. No need to classify this subheading. Okay, so directly you can write also. So some muscles we will see in that region also. See, the muscles we will see in that region. Just make the video on. I will show you. Make your video on. See, so the muscles. See here, sternum is here. Okay, sternum bone you can feel here. Okay, for muscles I am telling. Okay, and you will find one bone here. Just you feel in your neck region here. You will feel one bone. Okay, just feel here. You will find some hard structure here. This is the hyoid bone. Okay, just in between the hyoid bone and the sternum, you will find some here cartilage. That is the thyroid cartilage here. Okay, you can feel this moving part while swallowing. Okay, it will go up and down. So see, the muscles you will see here. See, one muscles will extend from the sternum to the hyoid bone. Okay, one muscles will be there, extending between the sternum and the hyoid, and one more muscle is there extending between the hyoid bone and the thyroid cartilage here. Okay, from here you will not see. Just we have to open. So from here to here, one muscle it will extend here, and one muscle from here to thyroid cartilage. So two muscles, sternohyoid. See, hyoid bone is there. Okay, so this is the sternum. So from sternum to the hyoid bone, there is one skeletal muscle is there. That is the sternohyoid muscles. You will see here. Then one more muscle extending between the sternum to the thyroid cartilage here. So sternothyroid. Okay, sternohyoid and sternothyroid. In muscles, you write these two names. Okay. Sternohyoid. Sternothyroid. Okay. So they are the major muscles you will see in this region. And even you will see the longus pollicis muscle also. Okay. Only lower end you will see. Okay. But here this the part of longus pollicis only you will see here. Okay. Whole muscles you will not see in this region. But sternohyoid and sternothyroid you will see. Okay. So the longus pollicis. So these are the muscles you will see in this region. So longus pollicis will be in the posterior aspect. From here we cannot see. That is the muscles in the posterior aspect. Okay, and that you will not see from outside. Inside you can see this muscle. But sternohyoid and sternothyroid, after removing this skin and superficial fascia, you will see directly that muscles. Longus pollicis will be in behind. Okay, from inside behind these muscles. Okay. So these are the muscles. So sternohyoid. So name only suggests the attachment of these muscles. See, sternum to the hyoid bone. Sternohyoid. Sternum to the thyroid is the sternothyroid. Okay. So next is the tubular structure. So what are the tubular structure you see in this region? Two tubes are there. One is food pipe. One is wind pipe. So one carrying the food, one carrying the wind. So the two tube you will see is the esophagus and the trachea. So the esophagus, and see in the picture also. So the esophagus and the trachea you will see here. See in this picture here. These are tubular structure. One is esophagus, one is the trachea. You will see in this region. Okay. Again you will see one duct. One duct, that is the terminal part of thoracic duct. See this thoracic duct. So two tubular structure is the esophagus, trachea. And on top you will see that is the thoracic duct, that is the terminal part. Terminal part thoracic duct you will see in this region. Okay. This is about the muscles and tubes. Okay. Now we'll go for the vessels. So what will be the vessel you will see in this region? See here. Can you see this bluish color? Slightly bluish color is here. This whole structure. And can you see this slightly reddish color, but it's not reddish color? This arc you can see. Can you see this arc? This arc vessel. Okay. Major is this thing only. This vessel. One vessel is this, and one vessel is this. Major. Okay. So the vessels you will see is the arch of aorta. Arch and its branches. This is artery. Okay. Arch of aorta and its branches. Can you see this arc vessel one? This is the arch of aorta. Okay, and its branches. You see these branches from here. One branch is going like this. One branch is going like this. One branch is going like this. Can you see these three branches from arch of aorta? This whole thing is the arch of aorta. From here, one branch is, two branches, three branches. These branches. So, what are the name of these branches? You should know now. So the first vessels you will see, that is the arch of aorta and its branches. Now I am going to write the name of that branches, three branches. Okay. So see, can you see this branch? This is the brachiocephalic artery. This branch is from arch of aorta, that is the brachiocephalic. Next branch from the arch of aorta, that is the left common carotid. You can see this just behind these vessels. And next one is here. From here, this is the left subclavian. Okay, left subclavian. So the branches are brachiocephalic artery. Okay, this you have to write full artery. Brachiocephalic artery, left common carotid. Left common carotid artery. Okay. Then next one is the left subclavian. So left subclavian artery. So they are the branches of arch of aorta. So the vessels you will see is the arch of aorta and its branches. What are its branches? They are the brachiocephalic, left common carotid, and the subclavian artery. Okay. Now the next vessels you will see is this vessels, this slightly bluish color vessel. Okay, so this bluish color vessels, that is the superior vena cava only. Okay, and it has got the two tributaries. Okay, so always remember that the vein has got a tributaries. Okay, artery has got a branches. Are you getting this thing? Vein always has got a tributaries. Don't say branches for vein. Okay. And for artery, always branches. Okay, now next is the superior vena cava. So the superior, terminal part of superior vena cava. See, this is the superior vena cava. Okay. So, can you see this structure, superior vena cava? And from here you will see the two tributaries. Okay, see, actually this superior vena cava is formed by two tributaries. This one tributary is this. One is this. These two tributaries, this combine together to form the superior vena cava. Okay. Always small vein unite to form large vein. Okay. Always small two vein unite to form large vein. And for in case of artery, always artery will break up into small branches. Because artery will go out. Okay. So it will divide as it go far and far. But vein means it will always come towards the heart. So small will unite together and form large. So always vein has got the tributaries. From small tributaries it will unite and form the large. So tributaries for the vein. In case of artery, always branches. Because as it move away, it will divide and into smaller and smaller. Okay. So see, right brachiocephalic, this is the left brachiocephalic vein. So the superior vena cava and its tributaries. Okay. So what are the tributaries? I will write here. Part of, yes, BC means superior vena cava. Okay. Shortcut. proximal part of superior vena cava you will see, and its is right brachiocephalic, right brachiocephalic vein now. Okay, right brachiocephalic vein and left brachiocephalic. You can see in picture also. You can see the picture in picture also. Okay, so right brachiocephalic and left brachiocephalic. These two tributaries unite together to form the superior vena cava. Okay, so these are the two vein you will see here, and one more vein. Okay, superior vena cava you will see. Then the two tributaries of superior vena cava you will see, and one more vein you will see in this region is the left superior intercostal vein also. Left. So these are the two veins. The vein you will see is the proximal part of superior vena cava, or directly you write superior vena cava. Okay, it will be easy for you. Okay, superior vena cava here. Okay, superior vena cava and its tributaries. And its tributaries. Okay. So what are the tributaries? Right brachiocephalic and left brachiocephalic. And next vein is the left superior intercostal vein. So these are the vessels. So arch of aorta and its branches, superior vena cava and its tributaries, and next one is the left superior intercostal vein. These are the vessels you will see in this region. Major vessels you are going to see in this region. See, actually this left superior intercostal vein, it drains into the left brachiocephalic vein only. See here, you can see in this picture here. So this is one tributary for left brachiocephalic. This is the left superior intercostal vein. Okay, this also you will see in this region. Just remember the name now. What are the vessels you will see here? Arch of aorta and its tributaries, superior vena cava, sorry, arch of aorta and its branches, superior vena cava and its tributaries, and left superior intercostal vein. Just remember this, and you remember the tributaries also and branches also. Okay, these are the structures. See in the picture also. Now, see, this is the superior vena cava. These are the two tributaries, right and left brachiocephalic. This is the arch of aorta, and these are the three branches. And next one, third number vessels is, this is the left superior intercostal vein. These are the three vessels. Okay. Now we'll go for the nerve. You will see the nerve also in this region. So what may be the nerve? The major nerve that is going to supply the viscera, that is the vagus nerve. So right and left vagus nerve. Okay, vagus nerve you will see. Vagus nerve you will see. Again you will see the phrenic nerve. Phrenic nerve. Again you will see the left recurrent laryngeal. So these are the major nerve you will see in this region. See here one vagus nerve you can see here. Can you see this vagus nerve here? One vagus nerve. Next vagus nerve. This is right hand. See, all has got a right and left. Okay. So right and left vagus, right and left phrenic nerve. Okay. Right and left, both right and left, because we have got a right and left. Phrenic also right and left, but recurrent you will see the left only. So right and left, right and left. So these are the nerves. See, vagus nerve. See, this is the parasympathetic, the nerve fiber that carries the parasympathetic fiber. Okay, you know about the sympathetic and parasympathetic nervous system. Make the audio on na first. Sympathetic and parasympathetic. You know about that?
Sir.
Sympathetic and parasympathetic. What is difference?
Parasympathetic.
See, easy way to understand. See, especially for viscera, we have got a sympathetic and parasympathetic. Okay, we have got a sympathetic and parasympathetic for this, seeing these muscles also, this skin, erector pylorus muscles also, okay. But I am telling for viscera here now only, okay. So see for sympathetic and parasympathetic, it's very sympathetic means that is for fight, flight, and fight. 3 F. In condition of fight, while you are fighting, in condition of fright, when you are fright, and next one is the flight, when you are in the high altitude. So in that condition, okay, there is the effect of sympathetic nervous system. Okay. See, for example, if you are walking in the road and suddenly you saw one dog, the large dog, okay, and it is barking on you, then there is the activation of sympathetic nervous system. So it's the condition of fright, isn't it? Or if you saw the tiger, what will happen to your body? Okay, whatever the change that is going to occur in your body, if you saw the tiger, means that is due to sympathetic nervous system, isn't it? Then parasympathetic means, remember that you are in your own home, you are sitting in sofa and full relaxed condition. You are relaxing. That condition, the activation in your body is parasympathetic. So rest and digest condition. There is the activation of parasympathetic. In condition of fright, flight, and fight condition, there is the activation of sympathetic nervous system in your body. Okay. So here vagus nerve, that carries the parasympathetic fiber. Okay. For the viscera, abdominal or thoracic viscera or pelvic viscera. Okay. So this nerve passes along this mediastinum, superior mediastinum. Okay. Okay. Now next is the phrenic nerve. Phrenic means nerve related to the diaphragm. Okay. Supply to the diaphragm, phrenic nerve. And left recurrent laryngeal nerve. So this laryngeal nerve, that actually it is the branches from vagus only. Okay, left vagus only, and it innervate the your voice box, vocal cord, larynx. Okay, if paralysis of this nerve is there, your voice will change. Okay, during reading the clinical anatomy, it will come. Okay, so these are the nerves you will see in this region. Now, next structure you will see in this region is the thymus gland. Thymus gland, the hormone secreted, this secretes the hormone thymosin hormone, which is required for the formation of T cell, T lymphocytes, that is responsible for cell-mediated immunity. Maybe you have read this thing in physiology. Okay, just I am giving the brief introduction. Thymus gland, this is the gland only, endocrine gland, that secretes the thymosin hormone. In physiology, you may have read this thing. Thymosin hormone is required for the maturation or the formation of the T lymphocytes. The T lymphocytes, that is the cell of cellular immunity or cell-mediated immunity. You know the cell-mediated immunity and humoral immunity, you may have read in this in physiology, I think so. B lymphocyte, T lymphocytes. Okay, here thymus gland, that is for T lymphocytes. Okay, so the precursor cell. Okay, so the thymus gland also you will see in this region. Here, okay. It will extend from here, it will go over here. It extend up to the superior mediastinum. Okay, now the thoracic duct also you will see in this region. So they are the content of the mediastinum. Okay, content okay, boundary okay. So this you are going to write. Now we'll go for the next mediastinum, that is the we'll go for the inferior mediastinum. Okay, inferior mediastinum, it has got a part. Okay, okay. Now see inferior mediastinum, it has got a 3 division: anterior division, anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay, so now see the anterior mediastinum here. Before that, we'll go for the previous slide here to see the picture. Okay, see here now. Can you see this picture here? The position of heart. Can you see the heart here?
Yes, sir.
Yes, this is the heart, pericardium and heart. So just in front of pericardium and heart, there is the space is there. This is the anterior mediastinum. Just behind the pericardium and heart, you will see one space. This is the posterior mediastinum, and the remaining part. This is the middle mediastinum that consists of pericardium and the heart. So three. This white space in front of heart, this red space, position of pericardium and heart, and just behind this heart, this space, this whole space, this spacious is in the posterior mediastinum only. This space, this is the posterior mediastinum. Now first we will see the boundary of inferior mediastinum. Whole inferior mediastinum boundary we will see first. Now see, whole inferior mediastinum just below the, this is the transverse thoracic plane, just below this and just above the diaphragm. This whole region is the inferior mediastinum. So it has got a boundary, see here. Anterior boundary is by the sternum, body of sternum. Posterior boundary is by the T5, T6, 7, 8, 9, 10, 11, 12 thoracic vertebra and adjoining intervertebral disc. They are the posterior boundary of inferior mediastinum. Okay, I'll type here, then it will be easy for you. Just inferior, just I'll write in shortcut, okay, inferior mediastinum. So, anterior boundary, posterior boundary, superior boundary, inferior boundary, and boundary on the either side. Okay, on each side. In case of superior boundary, also in each side there is the mediastinal pleura. Okay, just you add that thing. Okay, on the each side there is the mediastinal pleura. For inferior mediastinum also same thing, mediastinal pleura and the mediastinal surface of lungs. Okay, now here inferior mediastinum. Anteriorly you will see the posterior surface of body of sternum. Posteriorly T5 to T12 thoracic vertebra and adjoining intervertebral disc. Superiorly there is the transverse thoracic plane. Inferiorly there is the diaphragm, and on the each side there is the mediastinal surface of parietal pleura or mediastinal pleura and mediastinal surface of lungs. Easy. Okay. So anteriorly, posterior surface of body of sternum. So this counts the anterior boundary. Then the posterior boundary by T5 to T12 thoracic vertebra and adjoining intervertebral disc. Superior boundary is formed by the plane of or transverse thoracic plane. Transverse thoracic plane. The inferior boundary is formed by the superior surface of diaphragm, and
Sir,
on the
1
each side you will
minute
see
now.
the mediastinal. Okay, mediastinal. Okay, so mediastinal surface of pleura and mediastinal pleura and the mediastinal surface of lungs. Okay, because inside the pleura lungs is there, so mediastinal surface of lungs also. Okay, or directly you write the mediastinal pleura. That is sufficient. Here also see the inferior boundary, superior surface of diaphragm. If you remember that. Okay. Now we'll go for the boundary for each subdivision. Okay, anterior, middle, and posterior. Okay.
Yes, sir.
Now that we have made the boundary of whole inferior. Now we'll go for individual subdivision. Now one first subdivision is the anterior mediastinum. So again, it has got a boundary, anterior boundary, posterior boundary, superior boundary, inferior boundary, then either side, okay, or two lateral boundary also we can take. Now see, now we are dealing this space, okay, anterior mediastinum, this white space is in front of heart. So what may be the anterior boundary for this anterior mediastinum? See in picture and tell anyone. See, this is the body of sternum. So what is their anterior boundary?
Posterior surface of body of sternum.
Yes, posterior surface of body of sternum. So you know this, posterior surface of body of sternum, correct only. Now what may be the posterior boundary? What is there in posterior? There is any boundary is there? Posterior there is middle mediastinum. So the content of middle mediastinum, that is the pericardium and heart, isn't it?
Yes, sir.
Content of, so the content of middle mediastinum is pericardium and heart. See in this picture. Okay, you remember the picture, you can write. Anterior, posterior is pericardium and heart directly. What may be the superior then?
Transverse thoracic plane.
Yes, transverse thoracic plane. It is not transpyloric plane, okay? Transverse thoracic plane. Thoracic plane. What is inferior?
Diaphragm.
Dome of diaphragm. What is on the east side? Mediastinal.
Surface of
Mediastinal pleura, mediastinal surface of pleura and lungs. Okay, so this forms the boundary of anterior mediastinum. Now we'll go for the contents. Okay, okay.
Okay, sir.
Now see, boundary is clear. Okay, if you remember the picture, you can write. Now what may be the major content? There is no any viscera are there. Okay, there is no any viscera. Just you will see some areolar tissue. You will see the ligaments. You will see here, and some vessels you will see here, and some lymph nodes you will see here. Okay. So see, the major portion of the thyroid gland, it will be in the superior mediastinum. See, if you see the structure of thyroid gland, sorry, thymus gland. Okay, the thymus gland is larger in case of children. Okay, so some part may extend in anterior mediastinum also. Okay, as the age increases, or if after puberty the thymus gland shrinks, okay, the size will gradually decreases. Okay, so it may not be in anterior mediastinum in case of adult. Okay, so in case of children, thymus gland, it has got a relatively large size, so some part may be in anterior mediastinum also. So the content are thymus gland, some part of thymus gland in case of children. Then sternopericardial ligament. Can you see this two green structure here?
Yes,
This
sir.
is sternopericardial ligament extending between the inner aspect of the body of sternum to the pericardium. Okay, I will so okay, now see here. So two are there, superior and inferior sternopericardial ligament. So name only suggests the attachment of that ligament. So sternum to the pericardium. Okay. Now next structure you will see is the vessels, that is the internal thoracic artery and its mediastinal branches. So internal thoracic artery, it is the branches of subclavian artery. Okay, those from the subclavian artery, this internal thoracic artery run along the either side of the sternum, along the anterior thoracic wall. In either side, in this side, sternum is here. On the either side, it will be there, along the thoracic wall. You will see this internal thoracic artery. Okay. that supplies the artery blood to the thoracic, anterior thoracic wall, and also to the diaphragm also, anterior part of diaphragm also. Okay. Then the other structure you will see is the lymphatics and the lymph nodes. Okay. A retroexternal group of lymph nodes you will see. The lymph nodes, lymphatics, there is the lymph. Okay. Then the other remaining space that is occupied by the areolar tissue. So here, one more is there. They are loose connective tissue. They are the areolar tissue. Okay. It will be there. So these are the content. So thymus gland is there, sternopericardial ligament is there, internal thoracic artery and its mediastinal branches or and its branches. The next one is the lymphatics and lymph nodes. Okay, are you getting content?
Sir.
Are you feeling sleepy or what?
No, sir.
Make the video on. Na? Boring lecture, na? Anatomy is full. New terminology are there. If you read means it is interesting only. If you don't read means it will be boring. Actually, doing dissection and reading is more interesting by seeing and reading. But here only theory is there. No? I cannot show you this just in picture only. I have to show. Now I'll show the sternopericardial ligament. Wait. We'll go for the previous slide. From where to where it extends, I want to show you that. Okay. So the see, this is here in the middle mediastinum. There is the pericardium and heart, isn't it? So here is the sternum. So the sternopericardial ligament. There are two in number, superior and inferior. Okay, superior sternopericardial and inferior sternopericardial. So this ligament extends like this from the inner aspect of body of sternum to the pericardium. In the picture, okay, I am going to draw this sternopericardial ligament. Suppose this one is the one sternopericardial ligament, one is like this. So two, they are the sternopericardium extending between the sternum and the pericardium. Okay, that is support fibrous tissue, band of fibrous tissue. Okay, extending between the sternum and the pericardium. They are the sternopericardial, two in numbers, one in the upper part, one in the lower part, attached in the posterior surface of sternum to the pericardium. So sternopericardial ligament. And the thymus gland also, it will extend up to here. So here will be the thymus in the superior mediastinum and some part will be in inferior also. I cannot draw here nicely. See here. This, suppose this is the thymus gland. So in superior also it is there and in some part in the anterior also. Okay. So next is the vessels is there. Vessels. It runs, suppose see in this picture now. It will, the vessels will run like this. One vessels will run along the one side of the sternum, next in the next side of the sternum, like this. It will run like this. Okay, just behind the sternum. Okay, just remember, just behind here in this region it will run. Okay, means sternum is here. Okay, in the either side of sternum one vessel is there, but it is inside, not outside, inside the thoracic cavity. Okay, so it will be in the anterior mediastinum also. So they are the branches of subclavian, right and left subclavian. Okay. Then other remaining space, this space, they are occupied by the areolar tissue. Okay, there is no space. So that space is filled up by the areolar tissue, that is the loose connective tissue. Okay, areolar tissue, it is a loose connective tissue. It's a type of connective tissue only. So then next we have got a middle mediastinum. Okay, we'll go for the middle mediastinum. Here only we'll see the boundary, then we'll go for the content. Okay. Let me see a nice picture. Okay, this is it. Okay, this is okay. So for the middle mediastinum, see. So the major content for the middle mediastinum, you will see the heart and the pericardium. Okay. So it is the space for heart and pericardium. That is the introduction actually. The middle mediastinum, This is the space for the heart and the pericardium and the heart. And other structure along with this heart and pericardium, you will see they are all the roots of greater vessels. All root of greater vessels you will see here. Plus you will see here phrenic nerve you will see here and musculophrenic vessels you will see here. Okay. Now see here. First we will see the boundary, then we will go for this. So again boundary will be the same. Anterior boundary, then if anterior is there, posterior is there. Posterior boundary is there, superior boundary is there, inferior boundary is there, and boundary on the either side or lateral boundary. Okay, on the each side, this side also, this side and this side, either side, superior boundary, inferior boundary, anterior boundary, posterior boundary. Okay, so what may be the anterior boundary? Obviously, anterior mediastinum. Anterior boundary. This is the anterior boundary. Na? Pericardium and heart is the content in the middle. So the anterior boundary is the anterior mediastinum. So this anterior mediastinum, there is very few space. So directly also we can write the sternum, body of sternum also, no problem. Okay. So here, so anterior mediastinum, content of the anterior mediastinum, or this anterior mediastinum is very minimal space. So some book you will find directly there the anterior boundary. There is the posterior surface of body of sternum also. Okay, directly you can write the body of the sternum also or anterior mediastinum. All the structures in the anterior mediastinum that forms the anterior limit for the middle mediastinum. See here, anterior mediastinum and its content, or directly the body of sternum. Now posteriorly, what is there? Posterior mediastinum.
Lower thoracic vertebra.
No, that is, see here is, this is the boundary of this much is only the middle mediastinum. Just behind the middle mediastinum there is the posterior mediastinum. That posterior boundary, that lower this 5 to 12 thoracic vertebra, that is for boundary for posterior mediastinum. This space is posterior mediastinum. This is posterior to middle mediastinum. So posterior boundary is posterior mediastinum and its contents. Okay, are you getting this? And its contents is esophagus, aorta. See, this is the aorta. There is esophagus is also there. Vagus nerve is there. Thoracic duct is there. Everything. So that forms the posterior limit for the middle mediastinum. Only this much is middle mediastinum. See, whatever is far behind, it is see, middle mediastinum. Just behind is posterior. Then whatever. So posterior boundary for the middle mediastinum, posterior mediastinum, and its content. The content in the posterior mediastinum that forms the posterior limit for the middle mediastinum. Okay. This vertebra is far more behind. Okay. Now what is the superior? Same thing.
Transverse thoracic plane.
That is the, yes, transverse thoracic plane. What is their inferior?
Dome of diaphragm.
Dome of diaphragm. Space surface of dome of diaphragm. Okay, same thing. If you target the superior surface, at least the diaphragm, that is sufficient for you. Okay. Then on the either side, mediastinal surface of pleura and lungs. Mediastinal surface of lungs means inside the pleura, lungs is there. Okay, and lungs has got a posterior mediastinal surface, diaphragmatic surface, apex. While reading the lungs, I will tell this thing. Okay, so this is the mediastinal surface of pleura. On the right side is the right, left side is the left, right and left. Okay, on either side. So they are the boundary. Now, what may be the content?
Esophagus.
You know.
in pericardium.
Yes, main is the pericardium and heart, and the root of the greater vessels means root of the vessels that is going out from the heart and just going entering in the heart. Terminal part. If vein is there, that is the terminal part of that vein. If artery is there, the beginning part of that artery, isn't it? See, artery will go out from the heart. The vein will go to the heart. So the root of vessels means that thing. Either the terminal part of the vein or the beginning part of that artery. So they are the root of greater vessels. Okay, like that. Now we will see this. So you will see the ascending aorta. Major is the first is the pericardium and heart. Okay. First number is pericardium, second number is heart, then third number is root of greater vessels. Now under root of greater vessels I will tell and see in the picture also. See here, see here. See, these are all the greater vessels. See this. So they are going, either they are going to the heart or they are just leaving from the heart. Okay. Now, what are the root of vessels? See, pericardium and heart major content. Okay. Now, then other are the root of greater vessels. Now, what are the root of greater vessels? Here, see. So the terminal part of superior vena cava. Root of now, what are the root of greater vessels you are going to see here? That is the part of, I write in shortcut, okay? Superior vena cava, you write in full form. Superior vena cava. Similarly, terminal part of inferior vena cava. Of inferior vena cava. Similarly, you will see the pulmonary trunk. Beginning of pulmonary trunk. Okay. Similarly, you will see the pulmonary vein. Similarly, you will see the ascending aorta. See, this is the arc of aorta. Arc of aorta is in superior mediastinum. Before arc of aorta, there is superior. There is the ascending aorta from heart. Then arc of aorta in superior mediastinum. The descending aorta posterior mediastinum again. The descending aorta is in posterior mediastinum. Okay. So the ascending aorta, ascending part of aorta. Okay, or ascending aorta, ascending part of aorta. See, so pulmonary vein, pulmonary trunk, pulmonary vein. There are 4 pulmonary vein. Okay, who are there? 3, 4, 7, 8. Okay. So they are the greater vessels. They are the root. Either they are vein are coming to the heart and artery are leaving from the heart. So they are considered as the root. Okay. Then the other structure you will see. Now nerve you will see. That is the phrenic nerve and the deep cardiac plexus. Phrenic nerve also you will see in this region. Okay. Phrenic nerve. Okay. Then the next nerve, you will see the deep cardiac plexus means that is a network of nerve. Just you remember, you will not see here. The phrenic nerve, that is the nerve of diaphragm. Okay. That initially in superior mediastinum also you have seen that. And that will again run along this mediastinum, then finally to the diaphragm. Diaphragm is below here, no, somewhere. So it will pass from up to down. It has to reach diaphragm. So this is the next one is the phrenic nerve. And next is the tracheobronchial lymph nodes. Okay, tracheobronchial lymph node. They are lymph nodes only. Just you write name of lymph node, tracheobronchial lymph node. Okay, here you will not see, they are very minor structure. During dissection also you will not see this thing. So the tracheobronchial lymph nodes. And nerves are phrenic nerve and the deep cardiac plexus. Then one more structure you will see is the, see, can you see this trachea here? This trachea you will see in superior mediastinum. Now trachea it will divide or bifurcate into 2, and right and left principal bronchi you will see here. Okay. Now after tracheobronchial lymph nodes, you will see the terminal part of trachea into right and left principal bronchi. You write. So the part of trachea and bifurcation into right and left principal bronchi. Just you write in full form, okay? Now, from your senior, they are calling. Actually, next class is their mind. Okay, up to here you remember now. I'm having next class for your senior, okay? So they are the major contents. Are you getting up to here? Middle mediastinum, okay, na? Okay. Now in other structure you will see RC. Musculophrenic vessels also you will see here. One more structure you add in the vessels, musculophrenic vessels. But it is not root of greater vessel, okay? Musculophrenic vessels or artery, you write. These are the content in the medial mediastinum. Okay. Now remaining portion we will deal in tomorrow. Okay. Just up to here you remember. I may ask tomorrow. Okay. The video should be on. I will ask individually. Root and its boundary and the content. Okay. Okay. Thank you, class. This is medial mediastinum. So just behind the medial mediastinum, this region, this is the posterior mediastinum. See this up to here, this whole thing. This region is the posterior mediastinum. So first we will know the boundary of the posterior mediastinum. Then we will go for the contents. Same thing, boundary anterior, posterior, superior, inferior, and on the two lateral side. Okay. Boundary of so the boundary again same thing. Anterior boundary. Okay. Now see here. What is there in the anterior aspect? See, heart is there, isn't it? In the upper part. See, in the lower part, diaphragm is also there. See, dome of diaphragm is also there. So this forms the anterior boundary. From here to here, this is the anterior boundary. So the anterior boundary, this is the content of the medial mediastinum, or we can directly write the pericardium and heart. Or in bracket directly you can write medial mediastinum. And also see in the lower part there is the dome of diaphragm also. That also forms the anterior boundary only. From here to here. This is the anterior. So the pericardium and heart and also the superior surface of or dome of diaphragm, that forms the anterior boundary of heart. Sorry, anterior boundary of posterior mediastinum. So this is the anterior boundary. So pericardium and heart in the upper part, in the lower part, you will see the dome of diaphragm, that forms the anterior boundary. Okay. So next is the posterior. So posterior boundary, see here you will see. Can you see this structure? Vertebra is there. So 5, 6, 7, 8, 9, 10, 11, 12. So from 5 to 12 thoracic vertebra. And in between each vertebra you will see here, this is the region for the intervertebral disc. So this is your posterior boundary for the posterior mediastinum. So the posterior boundary is formed by the T5 to T12 thoracic vertebra. and adjoining intervertebral disc. So this forms the posterior boundary. Are you listening?
Yes, sir.
Okay. So this is your posterior boundary. Okay. Now next is the superior boundary and inferior boundary. So the superior boundary, what is there in the superior boundary? The same thing. So that is the transverse thoracic plane that forms the superior boundary. So superior boundary formed by the transverse. So this transverse thoracic plane, it lies at the level of sternal angle anteriorly and posteriorly at the level of lower border of T4. Okay. Anteriorly sternal angle, posteriorly lower border of T4 vertebra. So this forms the superior boundary. Okay. See, this posterior mediastinum also communicate with the neck region through the prevertebral fascia. There is the space in, okay, just behind the prevertebral fascia. So from that space is communicate with the neck also through the superior mediastinum. Just remember this much. Okay. Now inferior boundary. So the inferior boundary, there is diaphragm only. Okay. So the superior surface of diaphragm. So see, anterior boundary also diaphragm is there. Some part of diaphragm is there in the anterior boundary. Okay. So inferior, there is again diaphragm is there. Okay. So anteriorly also diaphragm is there and inferiorly also diaphragm. So diaphragm contribute for both the boundary. Then on the either side, what is there? Mediastinal surface of pleura or mediastinal pleura, you can write surface of okay, pleura is there, inside pleura lungs is there, so the mediastinal pleura and the mediastinal surface of lungs. So that forms the boundary for the posterior mediastinum. Okay, so the anterior boundary, heart and the part of diaphragm is there. Posterior boundary, T5 to T12 thoracic vertebra and adjoining intervertebral disc. Superior boundary by the transverse thoracic plane. That plane passes along the sternal angle anteriorly, posteriorly to the lower border of the fourth thoracic vertebra. Inferiorly, there is the superior surface of the diaphragm that forms the inferior boundary. And on the either side, there is the mediastinal pleura and the mediastinal surface of the lungs. Okay. Now we'll go for the contents. Okay, what are the contents? What may be the contents? Now we'll see the picture here. Now see, these all are the content of the posterior mediastinum. Okay. So you will see here vessels, you will see vessels, you will see tube, you will see ducts, you will see nerve, you will see. In duct only, now lymph duct will come. Okay, okay. Now see here, vessels. What are the vessels you will see in this region? See, can you see this large vessel here? Can you see?
Yes, sir.
Okay, make the audio on, one of you. See, this is the one vessels. So here vessels you will see both artery and vein. artery and okay. So in vessels you will see both artery and vein here. See, in artery you will see the major vessels, the major greater vessels you will see, that is the aorta. Here you will see the descending part of aorta. So that is descending aorta you will see here. Okay. So see, ascending aorta you have seen in the middle mediastinum. Arch of aorta you have seen in the superior mediastinum. And now here you will see the descending aorta in the posterior mediastinum. Okay. Are you getting? So
Yes, sir.
ascending part was there, that is in the middle mediastinum. Arch of aorta you have seen in the superior mediastinum. Descending aorta you will see in the posterior mediastinum. So in the artery you will see the descending and its branches. Okay. And again descending aorta, it has got a two part, thoracic part and the abdominal part. Here you will see the thoracic part. Okay. So the thoracic part of descending aorta and its branches you will see in this region. Okay. This is the major artery you will see in this region. So in vein also you will see some vein, you will see azygous vein. Azygous vein you will see. Hemizygous vein you will see. And accessory azygous you will see. Okay. So here azygous is here. Okay. Here you can see in the right side. Similarly, this hemiazygous and the accessory azygous you will see in the left side here. Okay. In picture it is not given here. Okay. So these are the vein you will see here. So azygous vein, hemiazygous and the accessory azygous vein you will see in this region. Okay. So these all vein that drain the blood from the wall of the trunk. Okay. Especially posterior wall of the trunk. Okay. So they are the azygous veins. Just remember they drain the blood from the wall of the trunk region. Okay. So these are the veins, azygous, hemiazygous, accessory azygous vein you will see in this region. Okay. Are you getting?
Yes, sir.
Now the next tube, you will see the only you will see the food pipe here. Okay. So trachea now you will not see here. Okay. So the trachea you have seen in the superior mediastinum and the termination of the trachea into and division of the trachea into right and left principal bronchi you have seen in the middle mediastinum. Okay. So trachea ends there only. Now the esophagus you will see in the superior mediastinum also and it continue up to the abdominal cavity. So you will see this esophagus in the posterior mediastinum also. So the tubes you will see in here is the esophagus. Esophagus you will see. See, if you are writing the vein means you can write the tributaries also. Azygous vein, hemiazygous vein, accessory azygous vein and its tributaries. Okay. If you are writing the artery means just you write artery and its branches. Okay, that is sufficient. No need to write the name of the branches. This azygous vein, hemiazygous, accessory azygous, they have got the tributaries. Many tributaries are there. Okay, so you can write the azygous vein, hemiazygous vein, accessory azygous, and their tributaries. Okay, I'll write here. And their tributaries you will see. So the tube you will see is the esophagus you will see here. Then the duct you will see is the, can you see this green color beaded duct? So this is the thoracic duct. Okay, that is the lymphatic duct only, large lymphatic duct. So this is the thoracic duct. Okay, are you getting? Then in nerve you will see the vagus nerve you will see here, right and left vagus nerve, and one more you will see phrenic nerve you will see. Then one more nerve is there, greater and lesser splanchnic nerve you will see. I will tell about that. Okay. So the vagus, right and left vagus. Okay. Just I will write right and left vagus, Phrenic nerve also same, right and left phrenic nerve. Phrenic nerve you will see, and the major next nerve you will see is the greater and lesser splanchnic nerve. And one more structure you will see is the right and left sympathetic trunk. Right and left. So they are the main nervous structure you will see here. So right and left vagus. See right and left vagus from, because this vagus nerve that is the parasympathetic supply for all the viscera of thoracic cavity, abdominal cavity, and the organ in the pelvic cavity. So it has to go from neck to thoracic cavity, means that is the superior mediastinum. Also it has to pass from the posterior mediastinum to reach in the abdominal cavity. So right and left vagus will be there in the posterior mediastinum. Again, here is the phrenic nerve. Phrenic nerve is there to supply the diaphragm. Okay, you know this thing. A greater and lesser splanchnic nerve. See, parasympathetic nerve supply is already there by the vagus, but we need the sympathetic supply also. So these are the sympathetic fiber for the viscera. Okay. So from the thoracic spinal segment, these nerves they will arise. Okay, lower 5 thoracic segment. See, because sympathetic supply they are from the T1 to L2 spinal segment only. Okay, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12, and L1 and L2 spinal segment. While reading the spinal cord, you will got to know. So spinal segments. From these segments, the sympathetic outflow will occur that supplies all the viscera. Okay. So see, so that forms the greater and the lesser splanchnic nerve. That is the sympathetic outflow only. And next one is the right and left sympathetic trunk. For right and left sympathetic trunk, I will show one picture. Okay. Okay. Let us see one picture from Google. Okay. So before forming this splanchnic nerve, okay, they will first form the ganglia, sympathetic ganglia. Okay, chain of sympathetic ganglia they will form here. Okay. Now we'll see the sympathetic chain here. Okay. It is not visible. Next, okay. Can you see this diagram here?
Yes, sir.
Okay, it is not needed here, but this terminology I am going to make you understand here. See here. See, I have already explained you, na? Sympathetic nervous system. The sympathetic nervous system that is outflow from the thoracic and the lumbar spinal segment. So that spinal segment they are from T1 to L2 spinal segment. Now see in this picture. See T1 to T12 is there and up to L2 spinal segment. Okay, so these all fiber they are coming as a sympathetic out. They will form ganglia. They will form the chain of ganglia. Can you see this chain from cervical, thoracic to lumbar? See, this is the chain. Can you see this chain? It will be in the right side of the vertebral column also, left side of the vertebral column also. Okay, this is parasympathetic. This is the parasympathetic. Okay, one half they have given parasympathetic, one half they have given the sympathetic. But this will be in this side also, and this will be in this side also. Okay, on the both side. So this is this chain. Can you see this? This is the chain. So this is the sympathetic chain. Okay, it will be on the right side also, left side also, here also, in the right side also, left side also. So this is the sympathetic chain. Okay, that is formed by the outflowing fiber of the sympathetic fiber from the T1 to L2 spinal segment. Now see, after forming this sympathetic chain, they will give out the fiber, they will give out sympathetic fiber for the viscera. See, in the abdominal region, they will give the bundle of the nerve. They are the greater splanchnic and the lesser splanchnic nerve only. These branches, this bundle. Okay, they are the splanchnic nerve. Okay, after emerging from the sympathetic chain, they have got a name splanchnic nerve. Okay, so before, see the fiber they are coming from the spinal segment, then they will form this chain of ganglia extending from above downward on the both side. Okay, so that is the sympathetic chain. This is the sympathetic chain only. Okay, so this also you will see in the which mediastinum?
Posterior.
You will see this in the posterior mediastinum. Okay, so whereas you will see the splanchnic is that. Okay, the greater and lesser splanchnic nerve. So again, this is the parasympathetic fiber. Okay, sorry, sympathetic fiber, and sympathetic chain means that is the sympathetic chain. Okay, then are you getting content? So nerve you will see, artery you will see, vein you will see, duct you will see. Okay, and the duct is the thoracic duct you will see, and other structure you will see the lymph node also. Okay, mediastinal group of lymph node also you will see in this region. Okay, lymph nodes. Group of mediastinal group of lymph nodes also you will see in this region. Okay, they are the major content in the posterior mediastinum. Okay, if you remember this picture, it is easy. Okay, just remember, see tube. One tube is there that extends from neck also and in the superior mediastinum, and that passes along the posterior mediastinum, that is esophagus. You will see here. Now one tube trachea using the superior mediastinum, and it will bifurcate into the right and left principal bronchi, but that lies in the middle mediastinum. Vagus nerve you will see in the superior mediastinum, then in the posterior mediastinum. Phrenic nerve you will see in the superior also, posterior also. You will see the greater splanchnic nerve in the posterior mediastinum only. You will see the sympathetic chain right and left on the posterior only. You will see the thoracic duct in the posterior mediastinum, and the terminal part you will see in the superior mediastinum also. Like that. Okay. So one more vessels you will see in this region is the posterior mediastinum. That is the azygous vein, hemiazygous vein, and the accessory azygous vein also. Okay. So they are the contents for the posterior mediastinum. Okay, these are the boundary and the content of the individual mediastinum. Okay. Now we will go further some clinical anatomy also. Okay. Now they are the applied aspect of the clinical anatomy. Now almost mediastinum is over. Okay. Now we will see some clinical anatomy related to the mediastinum. One is the mediastinal syndrome. Next one is the mediastinitis. Mediastinitis is the inflammation of the mediastinum, content of the mediastinum. Okay. See, actually, see, mediastinum, it communicates with the neck. That is the retropharyngeal space of the neck. Okay, through the pretracheal and the paravertebral space. There is the fascia around the trachea, that is the pretracheal fascia is there, and there is the fascia just in front of the vertebra, that is the paravertebral fascia. So the space between this fascia, through this space only, the mediastinum will communicate with the neck region. So there is the direct communication is there. Okay, first superior mediastinum will communicate with the neck, then through the superior posterior will communicate. So see, so the communication is there means if any infection in the neck region is there means it may descend to the mediastinum also. Okay, are you getting? Huh?
Yes, sir.
So the pretracheal fascia. So retropharyngeal. Now see, there is a trachea around fascia around the trachea, pretracheal fascia. Just in front of the vertebra, there is a fascia, that is the paravertebral fascia. So in the space between this fascia, the mediastinum communicate with the retropharyngeal space. Just behind the pharynx, there is space. So that is the neck region. Just you remember neck region. So there is a communication between these two. So if any infection is in the neck region is there, if communication is there, means this may descend. No? This infection may migrate to the mediastinum. So it may lead to the mediastinitis. So this is the inflammation of the mediastinum. Okay, are you getting? Thus you can write mediastinitis and inflammation of the content of the mediastinum. That is sufficient. Okay. For understanding only, I am explaining this how this is going to occur. Okay. So mediastinitis means inflammation of the content of the mediastinum. Okay. Inflammation of the content of the mediastinum or inflammation of the mediastinum is the mediastinitis. Now next is their mediastinal syndrome. Mediastinal syndrome means it is the group of symptom. Okay, syndrome means group of symptoms. That means the group of. So the mediastinal syndrome means if any this mediastinum, it is the potential space. There is no space. This space is occupied by the various structures. You have already seen the content in the each mediastinum. So there is no space only. Okay. So see, if any tumor arises in the mediastinum, okay, then what will happen? If any tumor is there, there is no space for that tumor. So if any growth is there, then what will happen? It may compress the surrounding structure, isn't it? If there is no space and if any tumor is growing there means it will compress the surrounding structures, isn't it? So, if this tumor is going to compress the vein, like because vein are there in the mediastinum, if tumor is going to compress the vein, then what will happen? The vein, see, lumen is there in the vein. If tumor will compress this, the lumen will close. Then what will happen? The venous return will be obstructed. Okay, if venous return from the upper part of the body is obstructed, means blood from the upper part which is not able to go in the heart. If blood is not able to go to the heart, then what will happen? The vein in the upper part they will become dilated, isn't it? So that is the engorgement of the vein of the upper part of the body. So if any growing tumor is there, it may compress the surrounding structure. Whatever is there in the surrounding of the tumor, it will compress that. If the tumor is compressing a vein, means the blood flow is obstructed. If blood flow is obstructed, the vein is dilated because more blood is accumulated in the vein, so vein is dilated. If this tumor is going to compress the trachea, what will happen? If trachea is compressed, means you will feel difficulty in breathing, isn't it? So that's the dyspnea. Okay. So if tumor is compressing the trachea, that is windpipe, then that is you will feel difficulty in breathing. So this difficulty in breathing means dyspnea. See, if the growing tumor is compressing your esophagus, means what will happen? You will feel difficulty in swallowing the food, isn't it? So the difficulty in swallowing food means that is the dysphagia. Okay. Okay, are you getting?
Yes,
So
sir.
if tumor is compressing the nerve, that is the left recurrent laryngeal nerve, because left recurrent laryngeal nerve that supplies your voice box. That voice box that is for production of the sound. So if that tumor is going to compress that left recurrent laryngeal nerve, means your voice will change. That is hoarseness of voice will occur. Okay. If that tumor, growing tumor is going to compress that phrenic nerve, there is the paralysis of the diaphragm. Okay. If that growing tumor is going to compress the intercostal or subcostal nerve, then what will happen? There is the neuralgia. Neuralgia means the pain. Okay. Pain related to the nerve. Okay. If any compression for the nerve is there, there may be the pain along the. If growth is there, means it will going to compress the surrounding structure, isn't it? So if the growing tumor is going to suppress or compress the vein, let's say superior vena cava, okay, there is a vein that is superior vena cava is also there. So if it is going to compress the superior vena cava, then what will happen? Blood coming from the upper part of the body, it is not able to come back to the heart. Then what will happen? If blood venous return is obstructed, the vein is more blood is accumulated in that vein. If more blood continuously accumulated, then the vein get dilated. So that condition is the engorgement of the vein. Okay, are you getting? Okay.
Yes, sir.
Okay. Now this is about the mediastinum. Now we'll go for the next topic, that is the pericardium and heart is our main topic. Okay, up to here. Okay, na for you?
Sir, I have question.
Okay, okay, ask.
Sir, सर हामीले ट्रान्सभर्स thoracic प्लेनमा के अरे एसेन्डिङ आउर्टा इन्ड हुन्छ भनेको थियौँ, अनि मिडल मिडियास्टिनममा पनि एसेन्डिङ आउर्टा पर्छ भनेर लेखेको छु।
नै सुन्नु, अब म पिक्चरमा देखाउँछु है तपाईलाई। लिसन हियर। I'll show you in this picture, okay? At the level of transverse thoracic plane, we have read that there is the termination of the ascending aorta, isn't it?
Yes, sir.
And next thing, अर्को कुरा के भन्नुभयो?
सर हामीले आर्क अफ आउर्टा त्यहाँ इन्ड हुन्छ भनेको छौँ thoracic प्लेनमा, अनि मिडल मिडियास्टिनमको कन्टेन्टमा पनि एसेन्डिङ आउर्टा पढेको छौँ के हामीले।
Yes, हेर्नुहोस्, see, listen here. You have got a confusion here. See, this is the transverse thoracic plane, okay?
Okay, sir.
See, this is the transverse thoracic plane. You know this thing. Okay? So aorta has got a three part. Let me on the video. Okay. So aorta has got a three part: ascending aorta, arch of aorta, and the descending aorta. See, this transverse thoracic plane is here. So just this curved portion, this is the arch of aorta, and this going down portion, this is the descending aorta. And the part of aorta from heart to arch of aorta, this is the ascending aorta. This region is the ascending aorta. Now I'll go for the previous picture. Okay, one nice picture is there with me. Now see here. See, this is the transverse thoracic plane, isn't it?
Yes, sir.
Now see, this is the heart. Can you see this part of the aorta here?
Yes, sir.
Just below the transverse thoracic plane, this is the ascending aorta. And from here, this is the arch of aorta. And just below this is the descending aorta. Now I have told that arch of aorta, see beginning of arch of aorta lies in the transverse thoracic plane. Termination of arch of the aorta lies in the transverse thoracic plane. This is correct, isn't it?
Yes, sir.
So arch of aorta begins at the level of sternal angle, terminate at the level of sternal angle. That is correct. And it is the content of superior mediastinum. See, this portion is the superior mediastinum only. Now you have confusion in the ascending aorta. See, this is the ascending aorta. It is below the transverse thoracic plane, and so it is the content of middle mediastinum. Okay.
Okay, sir.
And see, ascending aorta terminate here only. So the arch of aorta begin, isn't it?
Yes,
So
sir.
see, ascending aorta in the middle mediastinum, it is terminating at the level of transverse thoracic plane. So arch of aorta begin. Then arch of aorta terminate at the level of transverse thoracic plane, and the beginning of descending aorta. Okay, confusion now. Okay,
Yes, sir.
okay.
Yes, sir.
Any confusion?
Yes, sir. Sir, anterior border of
So
mediastinum.
ascending aorta is the content of middle mediastinum. Arch of aorta is the content of superior mediastinum. Descending aorta is the content of posterior mediastinum. Okay now.
Okay, sir.
Okay, someone was asking question.
Sir,
What
sir,
is the question? Ask now.
sir, anterior boundary of mediastinum is formed
yes.
by sternum only or in costal cartilage also. Sir,
Once.
sir, anterior boundary of mediastinum.
Once.
Anterior boundary of mediastinum is formed by
Anterior boundary of
mediastinum. Is formed by sternum only or
see,
by costal cartilage also.
see, you can say costal cartilage here also because see, actually the anterior boundary is formed by the sternum and the overlapping portion of the lungs actually. Okay, lungs will come in front of this also. Actually, lungs will come here. Okay, lungs will come up. But see, some portion of the costal cartilage may be there. Okay, but ribs we cannot tell here. Costal cartilage, some portion we can tell. No problem for that. We can tell that also. Okay.
Yes, sir.
And see, in case of middle mediastinum, anterior boundary, see, that is the anterior mediastinum. And also we can write the lungs also. Some part of the lungs also will be extending in that anterior mediastinum. Okay, because I have tell you the major component in the wall only. If you read the everything means you have to read the posterior aspect of the body of sternum and the posterior surface of the costal cartilage like that. Okay.
Sir.
Now are there any question? Okay. Okay. No question? Boys? Boys? Now see here, now we'll go for the next topic.